feeling tired, gaining weight, or losing interest in things you used to enjoy. It might not just be stress. Your testosterone levels could be out of balance, and a simple blood test can reveal the truth. Welcome to Diagnope, where lab results and medical science are made clear. If you're tired of feeling confused by your test results, hit that subscribe button and tap the bell icon so you never miss a health tip that could change your life. What is testosterone? Testosterone is a hormone produced primarily in the testes in men and ovaries in women. It plays a key role in muscle growth, mood, sex drive, and energy. Imbalances can affect both men and women. Symptoms of low testosterone include fatigue, low libido, depression, and weight gain. High testosterone, while less common, can lead to aggression, acne, and infertility issues. When and why to test testosterone? Doctors may recommend testing if you show symptoms of a hormonal imbalance. Ideal test time, which is early morning when levels peak, usually ordered as a part of a hormone panel or male-female health check. Conditions that trigger testing include erectile dysfunction, irregular periods, infertility, fatigue, decreased muscle mass. Understanding the blood test. Blood test is called serum testosterone, and it can measure total testosterone and sometimes free testosterone. The normal ranges for men is between 300 to 1000 nanograms per deciliter, and for women 15 to 70 nanograms per deciliter. Labs may vary slightly, so always interpret with a doctor. Low or high levels should not be self-treated. It needs medical or clinical guidance. What affects testosterone levels? Number one is age. Levels naturally decline with age. Then another one is stress. Increases cortisol, which lowers testosterone. Another one is sleep. Poor sleep drops hormone production. Then diet. Deficiencies in zinc, vitamin D, and healthy fats can impact levels. Then the last one is medical conditions like diabetes, obesity, thyroid disorders. What to do if levels are abnormal? Don't panic. Labs are part of the puzzle. Lifestyle changes often comes first. Diet, exercise, stress control. In serious cases, testosterone replacement therapy (TRT) may be considered. Work with your doctor to retest and monitor progress. Testosterone is more than a number. It is a reflection of your total well-being. A simple blood test can offer insight and direction, but what you do with that knowledge is what counts. If this video helped you, give it a thumbs up, leave a comment, and share it with someone who might need this information. And of course, don't forget to subscribe to Diagnope for more health guidance made simple.